The American Heart Association says that cardiovascular disease is the #1 cause of death in America today. Cardiovascular disease includes strokes and heart attacks. People in their 40s and people with multiple risk factors should need to be concerned with heart attacks. The American Heart Association website also recommends that we start our heart attack prevention measures at the age of 20. The sooner we figure out our risk factor, the sooner we can start our preventative measures and avoid heart attacks. I'm going to talk to everyone today about what a heart attack is, the signs and symptoms, and diagnostic tests to determine if there is a heart attack, and the importance of the preventative measures. From the Medical Surgical Nursing Assessment and Management of Clinical Problems text, the definition of a myocardial infarction, also known as a heart attack, is the interruption of blood supply to the heart due to blockage of the coronary artery. Excess fats or lipids and white blood cells are the common cause for these blockages. These blockages can result in ischemia, which is a restriction in the blood supply, and the shortage of oxygen to the heart. If it's left untreated, damage or death, which is also known as an infarction, to the heart muscle or the myocardium can occur. Thus, we get myocardial infarction. I'll talk to you next about the signs and symptoms and the diagnostic tests runs to determine if a heart attack or myocardial infarction is occurring. If any of these following signs and symptoms occur, the heart attack must be treated as soon as possible. The signs and symptoms include chest discomfort, pain in one or both limbs, pain in the back, neck, or jaw, or pain in the stomach. Chest pain can also sometimes be misconstrued as indigestion, but we want to go in and have them verify that it's not indigestion and make sure that it's actual heart attack. Shortness of breath, cold sweat, nausea, and lightheadedness usually accompany a heart attack as well. If you're feeling one or any combination of these signs or symptoms, please call 911 right away. 911 or the EMS team is the quickest way to get you to the hospital to get treatment for your heart attack. Upon hospital arrival, you will be met by a physician who will perform tests to determine if there is an actual myocardial infarction. The nurse will draw up some blood work called cardiac enzymes, which is to determine if there is an issue. An increase in the cardiac enzymes will confirm that a heart attack is occurring. The doctor will also review patient history, perform a physical exam, and have an echocardiogram, also known as an ECG or an EKG, to be performed. An EKG is where they hook up a monitor that has 12 leads, well actually 10 leads, and it monitors the electrical activity around the heart. While these tests can determine whether or not a myocardial infarction has occurred, there are measures we can take to prevent a heart attack from occurring. Self-awareness is key to reducing the risk of a heart attack. The MayoClinic.com website states that a healthy diet is a good way to start. They suggest an 8-step plan on how to prevent heart disease. The first step is to limit unhealthy fat cholesterol. Limit the intake of saturated fats, trans fats, and cholesterol. Use low-fat yogurt instead of butter, or use low-sugar fruit spread instead of margarine. They also recommend choosing low-fat protein sources, such as lean meat, poultry, fish, low-fat dairy, egg whites, or egg substitutes. They also recommend that you eat more fruits and vegetables because they're a good source of vitamins and minerals. Selected whole grains because they're a good source of fiber and other nutrients that regulate heart health. Another important one is to reduce your salt intake. Too much salt will lead to water retention, which will increase your blood pressure, which also affects your heart and can be a risk factor for a heart attack. Controlling your portion size. If you eat proper portion sizes and don't eat too much, go for seconds, thirds, that will help decrease the calorie intake and decrease the work on your heart. They also recommend creating a menu and planning ahead and cooking your meals so that you can make the right portions and the right foods. But lastly, they want you to also allow yourself an occasional treat. The occasional bowl of ice cream isn't going to hurt your heart-healthy diet. And this way, it'll keep encouraging you to stay on that diet as opposed to using it as an excuse to come off the diet. The Center of Disease Control website also recommends regular exercise, maintaining a healthy weight, smoking cessation, and limited use of alcohol in addition to eating a healthy diet. With regular exercise, the increase in physical activity will lower cholesterol and lower your blood pressure. If you maintain a proper weight, maintaining a proper weight is key because obesity and overweight is also being overweight is an increased risk factor for heart disease. Quitting smoking will also decrease the risk. Whether you've been smoking for 1 month or 5 years, 10 years, the sooner you quit, the lower your chance of heart disease or heart attack will occur. And also alcohol. Limit your use of alcohol because it will raise your blood pressure. Also, the CDC recommends treating or preventing medical conditions that could assist in a heart attack. If you're on medications for cholesterol, diabetes, for diabetes or cholesterol, you need to have your cholesterol checked every 5 years. Have your blood pressure monitored regularly as there are no signs and symptoms for an increased blood pressure. Manage your diabetes by monitoring your sugar levels and following your doctor's instructions and taking the medicine when you need it. Lastly, talk with your healthcare provider to prevent or treat conditions that can lead to heart disease. In conclusion, cardiovascular disease affects everyone, from people in their 20s to the people in their 40s and people who are older. Once you know how to determine the signs and symptoms, you can take appropriate measures to decrease the risk of a heart attack, and treatment can be quicker for an MI if you know the signs and symptoms. I hope that everyone here that's listening will take a look and reevaluate your current lifestyle to see if you're at risk for a heart attack, and take the appropriate measures to lower the risk if you feel that you are. MI can affect people of all ages, and with proper risk reduction measures, you can avoid becoming the next statistic.